Blood cancer patients often face a stark reality. When standard treatments fail, options quickly run out. This year's Breakthrough of the Year helps change that equation. Dr. Tommy Gambles, a postdoctoral researcher in the College of Pharmacy, has developed a new class of immunotherapy that takes a completely different approach. Instead of relying on traditional chemotherapy, his two-part system teaches the immune system to better recognize and attack cancer cells. It's more targeted, potentially safer, and offers hope when there was little before. But Dr. Gambles didn't stop at the discovery. He co-founded Thera-T Pharmaceutics to move this technology towards clinical use. That combination, breakthrough science paired with the drive to deliver it to patients, is what makes this work exceptional. Today, we recognize Dr. Tommy Gambles with the Breakthrough of the Year award for developing a therapy that could transform how we treat blood cancers and for having the vision to ensure it reaches the patients who need it the most.
I want to start by saying this is very much a collaborative effort by a lot of people up here on Upper Campus. I've worked with a lot of people in Huntsman Cancer, University of Utah Hospital, Primary Children's Medical Center, individuals at Research Park. It took a whole legion of folks to put our heads together and come up with this technology. So collectively, we're very honored to receive and be nominated for such a prestigious award. I personally want to thank everyone at the Technology Licensing Office, Dr. Hoteling, Dr. Lee, Kirsten, Corey, and everyone else that I worked with there. So thank you very, very much. And since it's myself up here accepting this award, I just wanted to share a quick anecdote of where the motivation of this therapy came from. I'm a Utah native. I did my undergrad here at the University of Utah. And during that time, I worked at Primary Children's Medical Center in the cancer unit. And I worked there for 4 years. And kiddos respond pretty well to chemotherapy. They're pretty resilient. We can typically get them into remission. But the longer I worked there, the more relapses I saw. More kiddos would come back, and oftentimes their disease was much harder to treat. So it was seeing that was the motivation for me to devote my time and effort to coming up with better therapies that were a little bit more patient specific. And so I was fortunate enough to start a PhD program here at the University of Utah in the Department of Molecular Pharmaceutics under Henry Kopacek. And he and I co-invented this technology. It's a new take on immunotherapy that's much safer, much more potent. And we're really excited to bring this into the clinic. And for us, the University of Utah is so collaborative, and we're so grateful to be a part of it. We work with experts at Huntsman Cancer, physicians at Utah Hospital, physicians at Primary Children's, entrepreneur folks in Research Park, and collectively we've all put our efforts into this technology to really push it forward and get it into the clinic. So the University of Utah is a fantastic center. We're so grateful to be a part of it, and we're going to push this into the clinic. We're going to develop this out and start saving lives. So thank you so much for this reward.
What an amazing breakthrough, and I love that you shared that story and how you were inspired to go off on this particular research program. Definitely high impact, right? These are the sort of stories that just remind us why researchers do what we do, and that research is one of the most important, impactful things you can do, right? Congratulations, Tommy.